Blooming is one of the artifacts that we can see on color Doppler imaging, and this is where the signal from the color Doppler spills beyond the actual vessel walls. Here's a case here where you can see this right adnexal mass, and you can see what looks like quite a large vessel right here. But when we look at it on the B-flow mode, which is a non-Doppler image and actually shows the true size of the vessel, we can see here that that vessel is actually much narrower than is depicted on the color Doppler imaging. And so what causes this artifactual blooming of the size of the vessel? Well, one of the features can be from increased gain on the color Doppler image. It can also be from low wall filter setting. Another cause can be from the low pulse repetition frequency and poor lateral resolution of the transducer. So why does this matter? Well, it leads to an overestimation of the vessel diameter or mistaken flow in surrounding tissue, and it can obscure vessel boundaries or mimic pathologic flow. And so here's an example here of a color Doppler image where we're looking at the renal vein here. There was concern of renal vein thrombosis, and it looks like here there's no renal vein thrombosis, but we ended up getting a CT scan of that same area, and sure enough you can see this non-occlusive renal vein thrombosis. And so the reason that we're getting this is because of blooming artifact. So blooming artifact is really important to note. It's one of the limitations of color Doppler imaging to assess whether there's thrombus within the vessel. Ways that we can reduce it are lowering the color gain, optimizing the pulse repetition frequency, using appropriate wall filter settings, and then zooming in or using a higher frequency probe for a better resolution.